Welcome to This Explainer. Today, we're diving into something that affects literally millions of people around the world, but honestly, it's still so misunderstood. We're talking about fatty liver disease. We're going to break down exactly what's happening inside your body, but more importantly, we're going to highlight an incredibly empowering fact. For the vast majority of us, this condition isn't just preventable. In its early stages, it's completely reversible. So let's get into it.
Okay, let's dive into this. Here's our clear roadmap for today. First, we'll meet your liver. Then, we'll uncover the silent epidemic, look at diagnosis and danger signs, and finally, we'll talk about reversing the damage.
Section 1. Meet your liver, the body's multitasking factory. Your liver is, without exaggeration, an awe-inspiring organ that's absolutely essential to keeping you alive. I want you to picture your liver as this highly efficient, massive, multitasking factory. Inside this factory are microscopic workers called hepatocytes, and they are tirelessly handling everything you see here. They're pumping out bile for digestion, detoxifying toxins and drugs, synthesizing crucial proteins, keeping your blood sugar and cholesterol in check. They even store glycogen and vitamins. It is a massive, highly organized operation. But, as we're going to see, we run into some major problems when this beautifully functioning factory floor starts getting cluttered.
And that clutter? Well, it comes in the form of fat. Now, it's totally normal for the liver to hold a tiny amount of fat, but when that fat crosses the line and exceeds about 5% of the liver's weight, that's when we cross the threshold into fatty liver disease. Now, you might have heard this called NAFLD in the past, non-alcoholic fatty liver disease. The updated, more clinically accurate term is MASLD. That stands for Metabolic Dysfunction-Associated Steatotic liver disease. Yeah, it's quite a mouthful, but really it simply means you have fat accumulation driven by metabolic factors, things like obesity and insulin resistance.
Now, what's really interesting about this is that there are two entirely different origins for this exact same cellular threat. On one side, we have MASLD, which, as we just said, is driven by metabolic factors. Think type 2 diabetes, obesity, high cholesterol. It's essentially a cornerstone of metabolic syndrome. Then, on the other side, we have AFLD, or alcohol-related fatty liver disease. This one is caused directly by excessive alcohol consumption, and it can independently lead to alcoholic hepatitis and cirrhosis. So both of these cause fat to pile up in the liver, but they take entirely different pathways to get there.
Moving on to Section 2, the silent epidemic, from fat to fibrosis.
We really need to look closely at how this stealthy villain, this fat accumulation, actually disrupts our incredible liver factory. Let's walk through this chronological progression together. It all starts at step 1. Excess calories and insulin resistance prompt fat to just start pooling inside those hardworking liver cells. As that fat builds up in step 2, the cells literally swell up, and that creates oxidative stress. This triggers step 3, harmful inflammation. At this point, the factory is officially in crisis mode. If we ignore this, step 4 kicks in, which is fibrosis, basically scarring of the liver tissue. By step 5, that scarring becomes advanced and irreversible. We call that cirrhosis. And finally, step 6 is a complete systemic breakdown, leading to end-stage complications like liver failure or even liver cancer. It's crazy to think that what starts as just a few excess calories over time can eventually escalate into total organ failure if we just leave it unchecked. Now, there is an absolutely crucial distinction in the severity of this disease. On one side, we have simple steatosis. This is when fat is just sitting in the cells without causing any significant inflammation. At this isolated stage, it's relatively harmless. But the tipping point is MASH, or Metabolic Dysfunction-Associated Steatohepatitis. This is where that fat accumulation is paired with severe inflammation and active injury to the liver cells. That inflammation right there, that is the primary driver pushing the disease forward toward irreversible scarring.
Section 3. Diagnosis and danger signs. Catching the silent threat.
So, how exactly do we spot a disease that is literally notorious for being completely asymptomatic in its early stages? Well, since you often can't feel fatty liver disease at all, identifying your personal risk is just essential. Take a look at these key risk factors. If you, or maybe someone you love, are dealing with obesity, a sedentary lifestyle, type 2 diabetes, high cholesterol, or hypertension, your liver factory is definitely at a higher risk. Even conditions like polycystic ovary syndrome, sleep apnea, or just having a strong family history and getting older can elevate your risk. If these metabolic factors are part of your daily life, your liver absolutely warrants some closer attention.
So the crucial point is, while the early stages are completely silent, end-stage liver disease sounds some very, very loud alarms. If you ever experience vomiting blood or black stools,
severe jaundice, where the skin or the whites of your eyes actually turn yellow, sudden confusion, or severe abdominal swelling known as ascites. These are absolute red flags. You also might see easy bruising, severe bleeding, or extreme fatigue and muscle wasting. These symptoms indicate advanced, life-threatening cirrhosis or liver failure, and they require immediate emergency medical evaluation. No waiting around. Fortunately for us, modern medicine has an amazing diagnostic toolkit to peer inside the factory long before we ever reach those emergencies, and often without needing surgery. Blood tests give us a great snapshot of liver enzymes and overall metabolic health. Then there's the ultrasound. That's typically your first-line imaging test used to actually spot the fat. We also have the fibroscan, which is a specialized tool that evaluates both the fat content and the stiffness of the liver, helping to detect scarring. For really precise measurements, doctors might use CT scans or advanced MRIs. And finally, a liver biopsy. That remains the gold standard for officially diagnosing MASH and figuring out the exact stage of fibrosis. Before we move on to treatment, I want to highlight a highly surprising fact from our source material. Did you know that cardiovascular disease is actually a leading cause of death in patients with MASLD? It's true. Because this disease is deeply rooted in metabolic dysfunction, the health of your liver is inextricably tied to the health of your heart. Having an inflamed, fatty liver is essentially a major red flag for your entire cardiovascular system.
Section 4. Reversing the Damage, your Empowered Toolkit.
But right here is where the story shifts, and honestly, this is the most exciting part of this explainer, because the liver has an extraordinary ability to regenerate and heal itself. And this brilliantly illustrates that point. Achieving just a 7 to 10% gradual reduction in your body weight can dramatically decrease liver fat, completely wipe out harmful inflammation, and actually reverse early fibrosis. Think about that. You don't have to change absolutely everything overnight to see profound clinical improvements in your liver's health. So how do we actually achieve that? Well, it starts with nutrition. But I don't want you to think of this as some restrictive, miserable diet. Instead, look at it as a mandatory fuel upgrade for your factory. Adopting a Mediterranean-style diet is highly recommended here. We're talking about loading up on fruits, vegetables, whole grains, prioritizing lean proteins, fish, and legumes. You'll want to cook with healthy fats like olive oil and eat plenty of nuts. Oh, and definitely hydrate adequately with water. But equally important is what we need to limit: sugary drinks, refined carbs, highly processed foods, trans fats, and excess alcohol. Because those are the primary culprits that are cluttering up the liver's floor.
The second part of your toolkit is physiotherapy and movement. Getting physical activity literally sweeps that cluttered fat right off the liver's factory floor by reducing total body fat and sharply improving insulin sensitivity. The clinical guidelines suggest aiming for about 150 to 300 minutes a week of moderate aerobic exercise, things like brisk walking or cycling. And if you combine that with 2 to 3 sessions of resistance training, you'll increase muscle mass. Muscle acts as a powerful metabolic sink for excess energy, and it really combats the fatigue that so often comes with this disease. Plus, especially for older adults, adding in balance and functional training is just a fantastic idea.
It is so important to remember the stark contrast in the outcomes we're dealing with here. The early stages of this disease are highly reversible, entirely through those non-invasive lifestyle modifications we just talked about. However, if ignored, untreated end-stage cirrhosis or liver failure leaves patients facing the very harsh reality of a complex, major surgical intervention, like a full liver transplant. The power of early action simply cannot be overstated.
Your liver is an incredibly resilient, hardworking factory, and it actually wants to heal itself. It just needs you to create the right environment for it to do its job. So I'm going to leave you with this question to think about. Your liver has the incredible power to heal itself. What daily choices will you make to let it? Thank you so much for joining me for this explainer. I hope you're walking away feeling informed, focused, and most importantly, empowered.